Hi everyone. Today we have Professor Marko Jovic with us, who is a professor at University of Nis in Serbia. And we are going to start with MBBS ki Baat Dil se presented by Eduwisor with our first guest, who is Professor Marko Jovic. To start with, I would like to request Professor Marko to give us a brief introduction of University of Nis, which is located in Serbia.
Okay, hello everyone. I'm very glad that I'm here today, and I'm very glad that it's my pleasure that you invite me in your podcast. So it's really nice. It's really nice, kind from you. So I'm Dr. Marko Jovic. I'm professor at Faculty of Medicine, University of Nis, and I'm teaching the department. I teach our departments of histology and embryology, as well as I'm also one who are working with admission department for all international students. So University of Nis is the one of the fourth university in Serbia, and we have foreign students for a long years till now. The University of Nis opened 1960, and it's like 65 years till now we are working. So it's like a nice city. University is also very quiet, very nice, and we would like to have also a lot of students, and we are willing to work with foreign students.
All right. Now, to ask of Doctor of Medicine course, now, Professor, I would like to request you if you could give us brief details about the course, which is Doctor of Medicine. Also, if you could explain to us about the course duration and course structure.
Okay, so the Doctor of Medicine, so medical doctors at University of Nis, we have course for 6 years, so it's like 12 months, and after 12 months, all the students, so then in that time, the doctors, they reach like 360 points or 3,500 hours, medical hours, so it's like exactly the same like everywhere in European countries, and exactly the same like with UK. So when someone finishes Faculty of Medicine, University of Nis, and become medical doctor, he can apply anywhere in world to be a doctor for practicing.
All right. Basically, in the 6 years, they have to complete 360 credits as per European credit.
Yes, that's right. Yes, that's right.
All right. Also, Doctor, there are a lot of questions with respect to medium of instruction. So if you could brief our audience regarding what medium of instruction is being, taught to international students for Doctor of Medicine.
Okay, yes. We have very nice. So our faculty is really nice. We have a lot of classrooms. We have a lot of rooms for practice. So from very beginning, from the first year, our international students has some mentor program. So they have very new classrooms, for example, for histology, for anatomy, for all the subjects. On anatomy, you can say that we don't have plastic bodies; it's like real bodies, real cadavers. And histology, they have all the students has own microscope, and they can see on histological glasses by their own. And also for biochemistry, they start with laboratory classes as well as very, very soon. For example, students are really like to know about clinical subjects. Clinical subjects are also organized very well at University of Nis. Clinical subjects they start from third year, and from third year they are going to hospital. This is University Clinical Center Nis, and this is the biggest clinical center in South Serbia. So the students visit a lot of different patients with different disease, and they have really great knowledge about everything.
So to speak of the entire medium of instruction for international students is English, right, sir?
Yeah, it is completely English, 100% English from the first year to the 6th year.
Okay, and also one specific point you mentioned of real cadavers. A lot of the students, they have too much affinity towards looking at cadavers. So, which is a very good thing which you mentioned. Moving forward, I would actually, since you mentioned about clinical exposure, which is given to students from the third year, if you could give brief details about how many hospitals are affiliated to University of Nis, and how many departments, to speak of clinical rotations, like what exposure, clinical exposure do students get?
Okay, so we have the biggest in the medical campus. We have the biggest clinical center. This is the hospital, biggest hospital, University Clinical Center of Nis, what I already mentioned. So, and this is very big hospital, and a lot of patients from all the Serbia, like south of Serbia, come there and to be cured. And also we have many other hospitals, like I think 15 more, where our students can practice. So this is, I can mention some hospital. It's like Niška Banja, it's like for cardiology diseases. Then in another center for psychiatry. So this is like some center which is not really inside the campus, but very specialized center just for some disease, specific disease. So our students go there, also the foreign students and Serbian students, but they can practice also there. So we are willing to do that.
Now, what is the duration for internships provided to international students?
So for internship, if you ask me, internship after the graduation, internship is 6 months for international students. Is the same like for the Serbian students, and internship is completely free. After the internship, they can pass public exam, so they can get a license. This public exam, the state exam, exam. And they can take license for working in Serbia. So this state exam is usually on Serbian, but also could be in English. So it depends on the student how they chose.
Okay, but is there an opportunity or an option given to students to appear for these licensing exams in English, or are they specifically only in Serbian?
So it is they can choose Serbian or English language. Sometimes professor speaks ask them on English, sometimes on Serbian. We have like this state exam every month, so they can choose which one they can take. Usually after these 6 months of internship, they wait for 1 month more and they take the state exam.
All right. As per NMC regulations, sir, there are clear guidelines for 12 months of internship. So like you mentioned, only 6 months are provided. So just in case, like if students, they want an additional, they want to complete the entire 12 months of clinical rotations. So will there be an opportunity given to students for that?
Yes. We give them opportunity for 6 months more, so they can do months plus 6 months. So 6 months enough for the state exam. The other 6 months they can just provide for themselves and so to be there for themselves. So yes, but we provide for them.
All right. Any sort of support being provided to students, international students, for licensing process and registration, sir?
So of course we are supporting them everything. So all the documents what they need. Sometimes these documents is Serbian, and we provide everything for them, so they can easily apply for the license exam. It's not so difficult.
All right. To talk of, Indian students have a lot of affinity towards USMLE and plan. So this particular question, has been is being asked frequently by our audiences. Is that how does the curriculum at University of Nis, does it help students, in order to prepare them for licensing exams such as USMLE or plan?
Definitely yes, because we have a lot of students who finish faculty medicine and go to take second part of USMLE. Usually our students after the 4th year start first part of USMLE, and they passed during the studies. And after the studies, they should check take just the second part of USMLE and just go there. So we have now a lot of foreign students who are going to USA. So that's fine. So the curriculum is really helpful for the students.
Okay. To speak of Indian students, how has your experience been with Indian students studying at University of Nis?
So experience with Indian students, because we have the most Indian students every year. We accept 60 students on first year. For other years we have a little bit more. So half of it are Indians, and they are really. I think that they told me every time, so I think it's really like that. They really like Serbia. They really like Nis. They feel safe, very safe in Nis. So they enjoy the city. and also they enjoy the faculty because we are also all the professors are really helpful, really kind, and really would like to speak with the students. Would like to give them a lot of consultations so they can come speak to the professor every day. So yeah, it's nice. It's really nice. It's nice to see.
Since you already mentioned about the city, sir, some questions with respect to safety, especially for girls. Like how safe is Serbia for all kind of international students?
Yeah, well, I already mentioned it's like Nis is like 500,000 city. It's not a big city, and it's really safe. It's a really safe city. Even Serbia, it's really safe. So there is nothing happened till now for any international student. So I can say we are 100% safe. And anyway, if you're an international student or you're like from Serbia, just the normal people, you can walk around the city even until 3 a.m. in the morning. Nobody will ask you anything. So it's like really, really normal.
And that's really good to hear. What message, sir, would you like to give prospective Indian students who wish to study Doctor of Medicine course at University?
Okay, yes. So they are very welcome. All the students are very welcome to study medical faculty University of Nis. We are willing to accept prospective students, and we are really willing to have them a lot. And we provide really great knowledge from very beginning. And this is like our very the main point, to give them the best knowledge. When they finish the faculty of medicine, they can start working immediately as medical doctors. So yeah. I would like to say welcome to everyone to come to try to study.
It was really a pleasure to talk to you, sir. And good thing is that you've been organic and very candid with all your answers. And we really hope that students and parents who shall watch this episode of MBBS Ki Baat Dil Se, presented by Eduwisor, shall get the message through. And we would also like to invite students that if they want to take admission at University of Nis, Dr. Marko Jovic is with us. So you can always contact us for admission. Thank you.
Thank you.
And it was a pleasure talking to you, sir. Take care.
It was my pleasure. Thank you.